Have you ever gone to the doctor just to be safe and left feeling more scared than before? Maybe it was a scan, a test, or a checkup that seemed routine. But afterward, the results brought more questions than answers, more worry than peace. And suddenly, you're caught in a whirlwind of follow-ups, medications, even surgeries, when you were feeling just fine before. Or maybe it's not even about you. Maybe it's your mom, your dad, your spouse, someone you love over 70. You took them in for a test because that's what we're taught to do. Early detection saves lives, they say. But what if that test did more harm than good? What if the truth is this? Not all medical tests are meant for everyone, especially not as we get older. Some can cause unnecessary fear. Some can lead to treatments that lower quality of life, and others, they just don't make sense when you're in your 70s, 80s, or beyond. I know that's hard to hear. I know you want to do what's best. That's exactly why this video matters. Because when you're over 70 or caring for someone who is, health isn't just about catching things early anymore. It's about making choices that bring comfort, clarity, and dignity. It's about living fully, not just surviving. And sometimes that means saying no to tests that do more damage than good. So in today's video, we're diving deep into 5 health checkups that older adults should seriously reconsider. Not because we're against medicine, but because we're in favor of smart, compassionate care. You'll learn what these checkups are, why they can be risky, and most importantly, what to do instead. I promise, this will change the way you think about aging and medical care. If you're ready to take control of your health or that of someone you deeply care about, go ahead and comment health first down below. I'd love to know you're here. And don't forget to subscribe to LifeStamina, your go-to place for honest, empowering conversations about aging, family, and living with strength and wisdom. Let's begin with the first checkup that needs a second thought, the PSA test for prostate cancer. Now, I want you to picture someone like Mr. James. He's 74, still walks every morning, loves fixing things around the house, sharp as ever. No complaints, no pain, just the usual annual checkup. His doctor says, let's run a PSA test just to be thorough. So they do it. The result? Slightly elevated PSA levels. Just a little over the line. Suddenly, Mr. James finds himself being sent for a biopsy. It's uncomfortable, stressful, and it doesn't stop there. A few weeks later, there are consultations, possible surgery, medications, and endless worry for him and his family. Months pass, and after everything, it was a false alarm. Here's the thing most people don't know. PSA levels naturally rise as men age. It doesn't always mean cancer. And even if cancer is found, many types of prostate cancer grow so slowly in older adults that they never cause real harm in a person's lifetime. But once the fear sets in, it's hard to undo. And the treatments that follow, surgery, radiation, hormone therapy, can come with very real consequences. Incontinence, impotence, emotional distress. Many believe catching cancer early is always the best route. But sometimes, catching something that might never have affected you ends up doing more damage than the disease ever would have. If you or a loved one are over 70 and not experiencing any symptoms, it's okay to ask your doctor if the PSA test is really necessary. You're not refusing care. You're choosing care that makes sense. Now let's move to something that affects just as many women in their later years. Routine mammograms after the age of 70. Imagine Evelyn, she's 76, lives alone, independent, makes the best peach cobbler you've ever tasted. She's never had any health issues, but out of routine, she goes in for her annual mammogram. It picks up something small, a shadow. They call it early stage. She's scared. Her kids are scared. They push for the next step. Chemotherapy, radiation, hair loss, fatigue, pain. Her appetite changes, her mood shifts. She doesn't feel like herself anymore. All this for something that, truthfully, may never have progressed at all. Now, I want to be very clear. Mammograms can save lives. But after 70, the benefit starts to shrink. Most breast cancers found in older women are slow growing. They may never cause symptoms. Yet the treatments that follow can be harsh and unnecessary. It's a hard balance, not wanting to ignore something serious, but also not wanting to overtreat something that isn't life-threatening. So here's a more thoughtful path. If you're healthy, if you're expected to live many more vibrant years, then yes, have the conversation. But if you're slowing down, or if your risk is low, it might be time to stop the annual mammogram and focus on overall well-being instead. Next up, one of the most dreaded tests out there, the colonoscopy. Now Paul, he's 78, had been through a few of these already. Clean results every time, but his doctor says, "You're due for another," so he agrees. The night before, he drinks the prep solution. It flushes everything out, but it also dehydrates him badly. He wakes up dizzy, falls in the bathroom, ends up in the ER before he even makes it to the procedure. That colonoscopy found nothing. But the ordeal? It left him shaken, weak. It took weeks to recover. Colonoscopies aren't light procedures. They involve sedation, can cause bleeding, or even perforation of the bowel. And after age 75, if your previous screenings were normal, the chances of benefit drop dramatically, while the risks increase. We live in a better safe than sorry culture. But sometimes being safe means not doing something that could put your body through unnecessary trauma. If screening is still needed, non-invasive options, like stool tests, can be far safer for older adults. Now, let's talk about something more recent and often driven by fear and advertising. The full body scan. These are marketed everywhere. Walk-in clinics offering the chance to catch everything early. They sell peace of mind, but they often deliver the opposite. Lydia, 72, saw one of these ads and decided to do it. Why not, she thought. The scan found a small nodule in her lung, tiny, barely visible, but suddenly that tiny spot led to surgery. Then came infections, antibiotics, panic. She lost weight, her anxiety spiraled. In the end, the nodule was benign, totally harmless. Full-body scans often pick up things called incidental findings, harmless variations in the body that aren't dangerous, but look unfamiliar. And once they're spotted, doctors feel pressured to do something. It's a domino effect of anxiety, procedures, and possible harm. The truth? If you're not showing symptoms, if there's no specific issue, you probably don't need a full-body scan. What you do need is a good doctor who listens. A conversation, not a marketing pitch. And finally, let's talk about something that feels harmless, but really isn't. Frequent CT scans and X-rays. John, 80, had some minor back pain, nothing severe, but every few months he was told to get another scan just in case. After a while, his doctor raised a red flag. "John, you've had a lot of radiation over the years. Radiation exposure builds up. It doesn't just disappear, and older adults may be more sensitive to its long-term effects. CT scans in particular deliver far more radiation than people realize. Sure, it feels like gathering information, but more information isn't always better, especially when it comes at the cost of long-term health. Ask yourself, or ask your doctor, is this scan truly necessary? Is it going to change how we treat this condition? Or is it just out of habit? Sometimes rest, physical therapy, or simple movement is safer and more effective than yet another image. So those are the 5. Each one sounds helpful on the surface. Each one seems like it's designed to protect. But when you're over 70, the story changes, your body changes, and the way we care for it must change too. It's tough, isn't it? You want to do the right thing for your parents, your partner, maybe even for yourself. You follow the advice, you listen to the doctors, you check all the boxes, because that's what we're taught. That's what good health has always meant. But what if no one ever told you that more tests don't always mean more safety? What if no one ever warned you that some of these tests, these screens, these scans, these so-called precautions, can quietly steal away peace of mind, even quality of life? And what if all of it, all that poking and prodding, was never really necessary to begin with? I know, it's overwhelming, because when you're caring for someone you love, or you're the one aging, it feels like every decision is loaded. Every step carries fear and the weight of what if. But here's the truth that brings both relief and responsibility. Now, you know better. You're no longer just following routines. You're not doing tests just because they're offered. You're thinking critically. You're weighing risks. You're saying, I love this person enough to protect their peace, not just their pulse. That's not rejection. That's wisdom. That's care. That's choosing health with intention, not fear. So what can you do? Start with a conversation. Talk to your doctor. Not with panic, not with anger, but with calm questions. Is this test truly necessary at my age? Will it change the way we treat this condition? Are there gentler, safer alternatives we can consider? And if you're caring for a loved one, speak with them gently. Sit by their side. Explain what you've learned. Ask them how they feel. Sometimes the most powerful medicine is simply being heard. You are not powerless. You're not stuck. You have more say than you think. Because growing old, really growing old, isn't just about staying alive. It's about living with dignity, living with comfort, living with the confidence that your care is thoughtful, not rushed, meaningful, not mechanical. And that kind of care, it doesn't come from machines or scans. It comes from love, it comes from understanding, and it comes from the courage to speak up, even when it's hard. So take a deep breath. You've already taken the first step. You're here, listening, learning, becoming aware. You're doing more than most. And that is something to be proud of. Let's take a moment to recap everything we've covered today, because I know this was a lot to take in. Here are the 5 health checkups you may want to think twice about, especially after the age of 70. First, the PSA test for prostate cancer. Not because it's useless, but because it can lead to treatments for cancers that may never cause harm, especially in older men. Second, routine mammograms. After a certain age, the risk of overdiagnosis becomes very real, and the treatment can often cause more distress than the disease ever would. Third, routine colonoscopies. If you've already had clear results in the past, repeating this test in your late 70s and beyond could put you through more risk than reward. Fourth, those tempting full-body scans. They promise peace of mind, but often create a domino effect of fear, unnecessary treatment, and emotional exhaustion. And finally, frequent CT scans or X-rays for minor complaints. Radiation builds up over time, and many scans simply don't change the treatment plan at all. In fact, they can make things worse in the long run. Now, this doesn't mean you should ignore symptoms or avoid doctors altogether. That's not the message here. The message is, ask questions. Think about the why. Look at the whole picture. Because the truth is, tests aren't harmless, especially when they're done just because. Especially when they take a toll on our bodies, our emotions, or our sense of peace. And now I want to hear from you. Have you, or someone you love, ever gone through a medical test that felt unnecessary? Something that made things more stressful, more painful, or just didn't sit right with you? If so, I'd be honored if you'd share that story in the comments below. Every single one of those stories matters. They help others feel seen, they help us all learn. And yes, I read everyone. And if this video gave you some peace of mind, or helped you look at things in a different light, if it made you feel less alone in this journey of aging, caregiving, or decision-making, then I invite you to subscribe to LifeStamina. This is a space for real talk, for honest conversations, for stories that help us age with grace, courage, and intention. Not out of fear, but out of love. Not to chase perfection, but to choose peace. And not just to survive, but to live wisely, fully, and well. Thank you for spending your time with me today. Thank you for caring. Thank you for being someone who shows up for yourself and for the people you love. Stay informed, stay compassionate, stay strong. And until next time, take care of yourself and take care of those you hold dear.